Hello, greetings to all of you. Assalamu alaikum rahmatullahi wa barakatuhu. From the country of many water, land of many water, Guyana, South America. I would like to thank the organizers of the Second International Medical Congress of Izmir Democracy University, Turkey, for inviting me to talk with you this very important topic that is almost matching with the theme of the conference, that is healthy aging and aging associated diseases. So I'm going to discuss about the physiology of health, physiology of optimizing health with a focus on exercise as medicine. So how exercise, what is the physiological mechanism, how exercise is inducing good health, and how it is beneficial to prevent major type of non-communicable diseases. Thank you. So according to the data now from the Center for Disease Control and Prevention, the major killer diseases are not infective diseases nowadays. More than 65% or 68% of the deaths worldwide, as well as more than 75% of the deaths in low and middle income countries are due to non-communicable diseases. Majority of the deaths are due to very few diseases like diabetes, now cardiovascular, cancer, chronic respiratory diseases, and mental disorders. They are the major killers diseases, and they are all non-communicable diseases. So these non-communicable diseases, they typically cause death over prolonged period. Once they are getting diagnosed, the patients are getting diagnosed, they can survive for little longer time, and they require extensive and expensive treatments. Which one is having profound economic burden on the families, local communities, as well as their country. So these non-communicable diseases, the data shows that the leading risk factors for this type of non-communicable diseases, which one is major killer nowadays, is due to physical inactivity. If person is not doing exercise regularly, physically inactive, as well as other risk factors also, obesity, hypertension, smoking, is all, if we see, is almost related with the physical inactivity, and they also cause premature death in some cases. So physical inactivity is taken as a major health problem which can cause the risk and increases the risk of this type of non-communicable diseases. So how this is happening? Physical inactivity, that person is getting the physical fitness, level of the physical fitness, especially cardiorespiratory fitness, is decreasing, and person is more vulnerable to the obesity. Okay, and this is increasing the risk factor for the development of this non-communicable disease like diabetes, especially type 2, then cardiovascular diseases, heart problems, stroke, then cancer, respiratory problems, and it lead to the more disability and morbidity. It is going in a positive or vicious cycle if person is not important to the regular exercise. So the importance of exercise has been long before explained. Around 2 millennia ago, by the Hippocrates, as walking, he explained that walking is man's best medicine, and exercise is prescribed today as medicine for many chronic diseases. A battery of research shown that exercise and drug interventions are often potentially similar in terms of their mortality benefits in secondary prevention of the coronary heart disease, diabetes, rehabilitation after the stroke, or treatment of the heart failure. Many, if we search in the PubMed, we will get thousands of the literature related to that, either separately or in combination with the drug intervention with the exercise. So almost exercise domain and drug treatment, most of the molecular mechanism is almost similar there. This diagram showing how physical inactivity, sedentary lifestyle leads to this chronic type of diseases, non-communicable diseases. So when we are getting older and physically inactive, then there is more chance of accumulation of the visceral fats, as fats mostly in first fat there is in the subcutaneous layer, which is acting as a thermoregulator in the temperature regulation. But accumulation of the visceral fat, okay, they will cause a low level type of systemic inflammation. There is macrophage infiltration and chronic systemic inflammation because of this type of fats. And if we are physically inactive, there is decrease in the muscle mass. Muscle, when we do regular exercise, that accelerates the hypertrophy of the muscle, but no use, no there is trophic factors release, that will cause slow degeneration, slow atrophy of the muscle, and change in the muscle mass, decrease in the muscle mass is called sarcopenia. As especially for the induction of the erythropoiesis, blood cells formation, we need erythropoietin. So when we are doing regular exercise, when we are getting more hypoxic, there is more secretion of erythropoietin and maintenance of the blood volume, blood cells. But inactivity may lead to the anemia also. And this type of inactivity, and here it is showing due to inactivity person become more glucose intolerant, it will cause decrease the glucose sensitivity, and there is chance of more development of the insulin resistance and type 2 diabetes. This is showing immune cells, the more infiltration of the immune cell, more activity as release of the, this inactivity causes more release of the pro-inflammatory substances and development of the atherosclerosis, more type of fat accumulation there in the blood, and it lead to the atherosclerosis and cardiovascular diseases. And this macrophages and other immune cells, it will cause brain cells, okay, they will debris the brain cell and lead to the Alzheimer's disease, mental disease. So there is a good saying that those who think that they don't have time for bodily exercise will sooner or later have to find time for illness, because we are getting more, if we are not doing physical activity, exercise regularly, then we are more prone to the development of these diseases and illness there. So low physical fitness, abdominal adiposity and inflammation, there is a relation. How? Let's see. So physical inactive lifestyle provokes a vicious cycle of inflammation, as we discussed. Especially the key factor is development of the visceral fats there, accumulation of the visceral fats into the visceral organs, and that will lead to the activation of inflammatory pathways, especially pro-inflammatory substances, as we just shown, and we are going to discuss in the coming slides that insulin resistance, atherosclerosis, neurodegeneration, and tumor growth there. So person is more vulnerable to the development of cancer and muscle waste, sarcopenia disease, and this all diseases together, collection of this type of disease due to physical inactivity, that is the digiosome, can say. So randomized controlled trial by Cook, Madsen et al. So that habitual physical activity person who is doing regular exercise prevents this type of development of pathophysiological symptoms. Okay, especially in them there is no development of abdominal adiposity. So these things will be prevented. And insulin resistance associated with diet induced obesity, that is obesity, less chance of obesity there. And this is showing magnetic resonance scanning study in two groups. So if a person is a step test here, persons are in group, persons are, their exercise level is decreased from 10,000 steps to 1500 steps for 2 weeks. Then it is showing here, this arrow showing the visceral fat amount in the magnetic resonance scanning study. So you can see here after the decrease in the exercise level, here there is more accumulation of the visceral fat, despite there is decrease in the weight. And this is showing the blood plasma level of the cholesterol here into the, this is before and this is after. So certainly here it is getting increased, the fat level, cholesterol, lipid profile is increasing there. So physical inactivity leads to the poor fitness, accumulation of the visceral and ectopic fats, that is despite the subcutaneous fat. So visceral fat as well as fat in the liver and the skeletal muscle, that is called ectopic fat. So they increase the inflammatory response by visceral and ectopic fats. They will induce more systemic inflammation by recruiting more immune cells there. And immune cells, they are communicating by releasing the pro-inflammatory substances. So accumulation of visceral fat will, over time, it will cause inflammatory pathway, and this low level of inflammatory pathway leads to the insulin resistance. They will attack the beta cells, so number of beta cell decreasing, more accumulation of the fat and tumor growth there, and they are attacking the neurons also, so neurodegeneration and mental diseases there. So now we are going to discuss, if we are doing regular exercise, what will happen? Muscle is getting, they are adapted to the exercise and they will release series of chemicals. Okay, more than 400, more than several hundred peptides they are releasing. So this collection of the secretions, that is called secretomes, and their release of different chemicals, they are called myokines. So major myokines, major chemical messengers released by the muscle is leukemia inhibitory factor, interleukin 4, 6, 7, 15, and many more there we are going to discuss. So exercise provokes the release of these chemicals. Along with that, myostatin, which is decreasing the, which is preventing the muscle hypertrophy. So that is that chemical is myostatin. So exercise causes release of the myostatin inhibitor, so that it is causing hypertrophy of the muscle and maintenance of the muscle mass. Polyestatin from the liver, so especially this is causing more bone growth. So and brain derived neurotrophic factor, interleukin 6, they are involved in the fat oxidation, fat metabolism. So it leads to the more good beneficial fat conversion, that is high density lipids, and there is no more accumulation of the low density lipids. Interleukin 6 especially involved in the glucose and lipid metabolism, lipolysis, so it is decreasing the cholesterol level, increased cortisol secretion by the exercise, which is causing neurocytosis and lymphopenia, anti-cancer effects of this interleukin 6, and that decreasing the inflammation also, anti-inflammatory activity. Especially there is release of the interleukin 15, which is causing lipolysis of the visceral fat. So visceral fat is less will be the inflammation. There is very less chance of development of this non-communicable, major non-communicable disease related to cardiovascular, causing the cardiovascular problem, diabetes, cancer, etc. So muscle as an endocrine, interleukin 8 and CXCL1, they promote angiogenesis in the muscle. So very good blood supply. Insulin like growth factor 1, fibroblast growth factor 2, tumor transforming growth factor beta, they stimulate bone formation. They are beneficial for the strengthening the bone, the strong bone with the exercise. Polyestatin related peptide 1 and polyestatin, they are released by the liver. So they are maintaining the endothelial functions in the blood vessels and causes revascularization of the ischemic vessels, especially after the stroke. So that is the mechanism for the exercise is beneficial in the prevention as well as the rehabilitation of the stroke. And this is showing overall different chemicals, that is the myokines or secretomes released from the muscle in response to the exercise, and that prevents various type of diseases. Like here start from interleukin 15, 7, 6, 4, leukemia inhibiting factor. So that decreases the subcutaneous and visceral, especially visceral fat, and lipolysis of visceral fat. So that decreasing the level of the visceral fat. So no more chance of this type of chronic diseases. More lipolysis from the adipose tissue by interleukin 6, irisin metabolism, that decreasing the, and that causes this adipose yellow fat into the brown fat. And we have already discussed that IGF-1, IGF-2, these are good for the bone growth. And interleukin 6 also decreasing the gastric emptying. So if gastric emptying is decreases, that will decrease the glucose level, glycemic level, glycemic index. So person is, and it is also inducing the more insulin secretion, and it is causing beta cell growth. So maintenance of the beta cell growth. Interleukin 6 here, adrenal gland, they are inducing the more release of the glucocorticoid cortisol. And cortisol is anti-inflammatory itself. So it is decreasing the lymphocyte activity, lymphomania, and neurocytosis. Interleukin 6 decreasing the tumor necrosis factor, increase interleukin 6, increase interleukin 1 receptor antagonist. So interleukin 1 is a major pro-inflammatory substance. So in this way it is acting as an anti-inflammatory, and tumor necrosis factor, that is the inflammatory, so it is decreasing it. So inflammation into the low level of inflammation involved in the development and progression of type 2 diabetes. Especially this interleukin 1 beta is involved in mediating beta cell damage. Because of this they are released, and mostly it is more in the persons which have high level of the visceral fat. So that causes beta cell damage in especially patients with the type 2 diabetes. Tumor necrosis factor alpha is involved in mediating insulin resistance in cultured cells, and exercise may at least partly enhance insulin sensitivity by decreasing this type of pro-inflammatory substances. Interleukin 6 also stimulates proliferation of the beta cell, as I explained, and exercise also induces this more proliferation of the beta cell. So expansion of the pancreatic beta cell mass. So it is decreasing the chance of getting the development of the type 2 diabetes. And interleukin 6 also act on the gastric muscle and decreasing the peristaltic activity and gastric emptying. So reduce postprandial glycemia. So here this is a mechanism, interleukin 6 more released by the exercise. It is delaying the gastric emptying. So postprandial glucose is decreased. Okay. So it is decreasing the postprandial insulin secretion there. So if we are not doing exercise, what will happen? No exercise, no release of the interleukin 6, and these benefits will be gone. So more development of the atherosclerosis and visceral fat, more development of the tumor necrosis factor alpha, which promotes the atherosclerosis by increased triglyceride level, increased synthesis of LDL, decreased synthesis of good fat, that is high density lipids, include endothelial dysfunction. Okay, and polyestatin like one promotion that causes revascularization in ischemic limbs. Okay, so no more stress, no more exercise, this will be. Now I'm going to discuss a little bit about the cancer. So cancer is associated with low-grade chronic inflammation, as we discussed. We physically inactive person, there is more release of the inflammatory substance. So muscle, when we do exercise, their muscle is releasing the myokine, oncostatin M, and irisin that inhibits breast cancer viability in vitro, and myokinase spark has been shown to reduce tumorigenesis in the colon of the exercising mice. This study has been shown by the exercise. So this is showing the anti-cancer effect of the myokines, interleukin 6, that activate the natural killer cells, which will cause the binding with the tumor cell and their apoptosis. Similarly, oncostatin that causes apoptosis of the breast cancer cells, and spark causing apoptosis of the colon cancer cells. So it is very beneficial. So now almost we have to conclude that physical activity has many positive effects, and we discussed that there is molecular mechanism for each and every type of exercise has been already almost molecular mechanism has been shown by the various type of research studies. So muscular work protects against many non-communicable diseases, and exercise may work as a medicine, and we have already elucidated the how they are working, molecular mechanism. And exercise activates the multiple signaling pathway, which is similar to the drugs in most of the cases. So this is showing the reference. If you have any question, please you can email me also, as in the first slide I have shown you the email. Thank you very much for your patience here.